The term vocation derives from the Latin vocare, to call. The Oregon Health and Science University Child and Adolescent Psychiatry Training Program believes that careers in the service of young people and families are just that. Not a mere job, but a calling. Watching this video, considering your future, you may wonder, is OHSU calling me? If OHSU is calling me, should I answer? What makes this place special? To answer this, please imagine a walk in the woods with us, riding the tram, traveling around Portland and beyond. Appreciate the reflection of OHSU child and adolescent psychiatrists as they talk about their experience and hopes for the future.
There are many things that excite me about the future of the program at OHSU. We are in a phase of incredible growth of our division. We have very talented people here. We have a group of people who are very invested in the future of child psychiatry from a holistic perspective. From our research division, focusing on the influences of early childhood and prenatal health on outcomes for human behavior, to policymaking across the state. And through our own efforts, we now deliver services to primary care across the entire state of Oregon.
So as an inpatient child adolescent psychiatrist, being trauma-informed is pivotal to the work that I do. On the child adolescent unit at Unity, it's certainly a model we have to embrace in every point of contact with children and families that we work with. We embrace a style of communication called collaborative problem solving. That is inherently a trauma-informed way where we come alongside a child, get to know what are their lagging skills, what are their strengths, and it's really meant to be a relational and collaborative conversation so that we can have momentum in problem solving with not just the child, but as a family through crisis. We really want to empower the child to be the expert of their lives. We really want to help families be curious about what's going on for their child. How does the mental health crisis fit into the larger context of this child's story? And we really want to empower the child to be the author of their story. And so in that way, we certainly embrace being trauma-informed in everything that we do. And collaborative problem solving is the modality that we live and breathe.
The Bridge Clinic is a collaboration between Care Oregon, OHSU, and LifeWorks Northwest. It serves youth who've been in higher levels of care, like inpatient, in the ED for a mental health emergency, or other high levels of care, and works to create a transition plan for them to a long-term mental health provider. I think there's several ways in which fellows get to grow that might be particularly unique to Bridge Clinic as part of the fellowship experience. I think one of them is we do serve just a diverse population, and so I think people get exposed to things that they might not have had a lot of exposure, like early childhood work. Seeing younger children might be an example. And then I think another way that Bridge Clinic helps providers kind of find their voice and be more autonomous is there's the ability to have more independence in an outpatient setting. And so I try really hard to give them the room to find their own way. I think there's a lot of ways to practice child psychiatry. I like to try to give fellows room to figure that out for themselves and not always feel like they're doing things my way.
Our fellows have had the chance to participate in formal training for different psychotherapeutic modalities such as acceptance commitment therapy, trauma-focused cognitive behavioral therapy, general psychiatric management for adolescent borderline personality disorder. They all get Tier 1 certification for collaborative problem-solving approach. And one of the things I highly value in our psychotherapy curriculum is to also teach them the skills and the capacity to integrate these different psychotherapeutic modalities and to see the parallels. The value of psychotherapy and the magical power of psychotherapy primarily lies within the therapeutic relationship that the patient has with the psychotherapist. So as a result of that, our trainees are encouraged to work on developing an identity as a psychotherapist. We encourage them to seek their own psychotherapy. We provide ample opportunities for psychotherapy supervision. So we offer them 1 hour of protected time per week just to meet with a psychodynamically oriented psychotherapist in the community.
The biggest things that I've seen is the support you get for your wellness, in the sense that like you get a generous amount of vacation, sick days, you get the wellness days. But the beauty of it here is that people support you to take those things. There's no feeling of guilt or, feeling like you're gonna burden other folks. Like, they're all here to support you in taking that time.
Couple of things that I want the fellows to walk out with: to keep that curiosity with you, to don't feel like you need to have the answer. Be curious as much as you want. Look for the answer. Be persistent. When you have a question, listen to your clinical intuition. When you have like, what's that? Listen to it. Be curious. Go, doesn't matter how much it takes. Search for the answer, but also ask for help. Reach out to your colleagues, and don't be shy of saying, I don't know.
So, do the waters of the mighty Columbia, the ebb and flow of the Pacific, the whisper of the breeze through the trees in the Mount Hood National Forest call you? Does training in a place that honors the lived experience of young people and families, often coming to us in their most desperate moments, appeal to you? Are you eager to further develop skills in listening, formulating, and offering management strategies through a trauma-informed, developmentally minded, culturally humble lens? If so, we hope you'll apply to our fellowship and consider a life of service to the young people of Oregon.